Students, in this video, I'll discuss exemptions under GST to healthcare sector. So first, segregate any exemption under three parameters. First one, who is providing what service to whom? Supplier, nature of service, and recipient. Who is providing what service to whom? So first thing is 12AA or 12AB. So this 12AA or 12AB refers under Income Tax Act. Okay, under Income Tax Act 1961. Under Income Tax Act 1961, if they are registered under Section 12AA or 12AB, they can do these things. So out of this care counseling awareness, first they will start with the awareness. So awareness relating to what? Awareness relating to family planning, preventive health care, awareness relating to family planning, preventive health care, and HIV prevention. Regarding this, they will give some public awareness. So after awareness, if still people are not listening, they will do counseling. Normally, awareness is open to many people. Counseling is one-to-one. Okay, so I'm holding the banners and going on the road, creating public awareness. So family planning, don't have more children. India is burdened with more population, or prevent HIV, or take these healthcare measures. Okay, so therefore awareness is to general public, whereas counseling is one-to-one. Okay, so in spite of that, if a person has not listened and he suffered disease still, so then they'll go for the counseling, and after counseling they will go for the care. If the disease is attracted, care comes after attracting the disease. So care, awareness, counseling, and care. So this care and counseling is related to what? Again, care and counseling is related to HIV. Next, drug addiction, alcohol addiction, physically disabled, mentally disabled, terminally ill persons. Okay, care and counseling relating to these five activities. So HIV, drug addiction, alcohol addiction, physical disability, mental disability, terminally ill health. Regarding these five parameters, they will do either counseling or they will treat the patient. So awareness is related to three activities: family planning, preventive health, and HIV. So who is providing these services? Entity registered under Section 12AA or 12AB. To whom they are providing these services? Any person. They can provide these services to any person. They can provide these services to any person. That is first thing. Next, supplier is any person. They are providing to whom? Governmental authority. So any person, need not be charitable entity under Section 12A of the Income Tax Act. Any person, they can provide these services relating to public health to the government authority. So to whom we are providing services? To the government authority. Who is providing the services? Any person. So therefore here they have not specified the supplier, they have specified the recipient. Above case they did not specify the recipient, they have specified the supplier. Okay. Any person providing any service relating to public health to the governmental authority. Okay, right. So next, veterinary clinic. So this is healthcare of animals or birds. Veterinary means healthcare of animals or birds. Normally, sometimes they will exclude the horses. So horses is normally people will use for commercial purpose also. Therefore, in many exemption entries, they have removed the horses, but here they have not given exception to the horses. Horses also covered here. Healthcare of animals or birds. Okay, who is providing the service? Veterinary clinic. Any person. Next, any person transportation of patient in an ambulance. So transportation of patient in an ambulance. Normally, some ambulance persons will be there. That ambulance person need not be registered under Section 12AA of Income Tax Act, etc. He is a pure commercial operator. Okay, any person transporting patient in an ambulance to the hospital. Next, so these three is related to C means clinical establishments. Clinical establishments like hospitals. So hospitals are technically called as clinical establishments. AMC stands for authorized medical practitioner. Authorized medical practitioner. This will be there in the material, don't worry. Authorized medical practitioner. PM stands for paramedics. Okay, PM stands for paramedics. So these three: clinical establishments, authorized medical practitioner, and paramedics. These persons are providing. So what they are providing? Transportation of patient. Transportation of a patient in an ambulance. So that means the difference between these three is: this is an outside ambulance, this is a hospital ambulance. Okay, in both the cases, we are bringing the patient from the home to the hospital, from the hospital to the home. from the home to the hospital, from the hospital to the home. Okay, so bringing the patient either a hospital own ambulance or ambulance run by other private operators. In both cases, exemption is available, right? So I have arranged the points in such a way how the process flows in a hospital. So first you have to bring the patient to the hospital. That's why I have given that entry, transportation of patient. After patient entering to the hospital, what they will do? They will do diagnosis. They will do all the scannings, etc., to identify the problem. After doing the scanning, after identifying the problem, they will do the operations. That is called as treatment. After completion of operation, they will put the patient under observation. That is called as care. Okay, so bringing the patient to the hospital, okay, thereafter diagnosing, scanning the patient, and thereafter doing the operation, that is called as treatment. After operation, under observation, patient will be under observation, the doctor's observation for 2 or 3 days, depends upon the disease. That is called as care. Okay, so diagnosis, treatment, and care, any person. Next, these rooms, ICU, intensive care unit. ICCU means intensive cardiac care unit. CCU means critical care unit. NICU means neonatal intensive care unit. So the full forms will be there in the material. You can go through that. So any critical care units rooms are exempted, irrespective of the rent. Irrespective of the rent per day. Irrespective of the rent, they may charge 20,000 rent also per day, but still they are exempted. Okay, other rooms after completion of operations, after completion of ICA, they will bring to the normal rooms. For that normal rooms, if they are charging rent of more than 5,000, GST will be applicable. For the normal rooms, if they are charging rent of 5,000 or less, okay, GST is not applicable. Remember, this is applicable to normal rooms. For the ICU, no limit. Even if they charge more than 5,000 also, GST is exempted. Okay, don't remember hospital room rent 5,000. Within the hospital, which room rents are 5,000? Okay, so normal room rents are 5,000. IC rooms, any consideration, GST is exempted. Other room rent, rupees 5,000 per day is exempted up to 5,000. More than 5,000, it is taxable. Next, okay, so RRP, Registered Rehabilitation Professionals. RRB stands for Registered Rehabilitation Professionals. Government registered, okay, Registered Rehabilitation Professionals. Registered Rehabilitation Professionals. Okay, what they are doing service? Rehabilitation, therapy, counseling, or other activity. Okay, they are doing service to any person. But here it is important, sorry, I forgot, right? To any person, so they are providing service to any person, but the important point is where they are providing the service at. Okay, they are providing service at medical establishment. They are providing service at medical establishment or educational institution. They are providing service within the premises of medical establishment or within the premises of educational institution. They are providing this rehabilitation services. Next, okay, government recognized rehabilitation center. Government rehabilitation centers. Government rehabilitation centers. Next, rehabilitation centers run by 12AA or 12AB entity. The rehabilitation centers run by charitable entities registered under section 12AA or 12AB. They are providing at, they are not provided to the, they will provide service to any person, but at this premises, this is at is important here. At, okay, they are providing the services, who is providing service? Registered rehabilitation professionals. What kind of service they are providing? Rehabilitation, therapy, counseling, or any other activity. Okay, next, to any person at medical establishment, educational institution. So even though we are providing healthcare services at the educational institution, healthcare services we are providing at the educational institution, because this is related to psychology. Students will have some psychological problems. To treat that psychological problems, rehabilitation professionals are working at the educational institution only, or government rehabilitation centers or rehabilitation centers run by charitable entity. Okay, so these are the exemptions under GST relating to healthcare sector.